Hi, everyone. I'm Dr. Catherine Grill, the CEO and one of the co-founders of Neolth. Welcome back to another episode of Neolth Ask The Experts live stream events. I'm here with Neolth's Chief Medical Officer, Dr. Claire Wheeler, who is an expert in trauma. And we are going to be talking about recovering from trauma today, which is the topic that won the community poll on the Neolth app. So Dr. Wheeler, thanks so much for being here. I'd love for you to come off mute, introduce yourself, and share with us, what is trauma and what are some of the signs and symptoms of trauma?
Hello, thank you, Catherine, and I'm very happy to be here again with you and with everyone watching. As some of you may know, I am a former ER doctor, so I've seen a lot of trauma. And after I practiced emergency medicine for a while, I went and did a PhD in psychology, and my dissertation work was looking at how people react to traumatic events while they're happening and seeing what happens in the aftermath. So I followed people for 2 years after being injured to see how their recovery went and how that trauma affected them. And since then, I've done quite a bit of work in the mental health field, in communities and smaller groups of people who have experienced all different types of trauma, from natural disasters to gun violence to interpersonal events. And one of the things that I think is most important for people to know about trauma is that it is not rare. It's actually quite common even just in the United States population, and even more common globally in many parts of the world. Um, and that many times the early responses to a traumatic event might be seen by others as abnormal or over the top or inappropriate. But whatever a person is feeling, usually in the early aftermath, after something bad happens to them, is a normal, what we call a normal response to an abnormal event. And so the key really to understand about trauma is, first of all, anyone that you meet could have a history of trauma, and they will be at some point in the process of recovering from that trauma. And this is a multi-stage process that takes some people longer than others, but it's fairly well defined in the psychological literature. And we can very often predict how well a person's going to do based on the nature of the event and the age and other characteristics of the person who had that bad experience.
Thank you, Dr. Wheeler, for starting to share what trauma is with us. I think coming off of 2 years now of the COVID-19 pandemic, which has been a collective trauma for society, it's something that's a word, trauma, that's being talked about a lot. And I think especially for some of our young listeners, maybe they've never heard about trauma, or they don't know what it is, or they've heard about it just in specific circumstances. So I was wondering if you could dive a little bit deeper into what causes trauma. One thing I hear from young people sometimes is they think, well, it's the loss of a loved one, a death, or some sort of violence that will cause trauma, but nothing else, only those things. So I'm wondering if you could just share with us, what can cause trauma, and is it more of an expansive definition? Just wait for Dr. Wheeler to come off mute. I'm excited to hear what she has to
You'd think,
say.
yes, you'd think that after 2 years of this pandemic, that would be automatic, wouldn't you? Anyhow, when you were looking at how to define trauma or a traumatic event, there are different ways that we can look at it. And one of them is to look at the classical way that psychiatrists and psychologists look at trauma. And when we look to see if someone can be diagnosed with a disorder associated with trauma, what we look for is an event. And the event is a situation where a person feels that their life is in danger, or someone close to them is in immediate danger. And the most important word in that definition is perception. And so you can perceive yourself in danger in a lot of different situations. You can be in social danger, emotional danger, physical danger, occupational danger. There are many, many ways that a person's life can be affected badly by events. And so our definition of trauma is much broader than simply a isolated incidence of one bad thing happening to a person. And very often, for example, a lot of my work has been in people who've had severe injuries. The fallout from the injury itself can be a trauma. So the hospital treatment, the costs and everything. And so another thing to recognize about, especially when it's something bad that happened and it was a one-time event, like a shooting, that there's a tail to that, and the process goes on. And so even the way that people react to you after something happens can be traumatizing. And the way people talk about, like, let's say, for example, people who have experienced rape, and then they see people joking about it or other things happening, these are called triggering events or things that provoke a flashback. And so what we need to do is recognize that some of the ways that we treat each other can be traumatizing, whether or not a person has a history of trauma. And basically, what it boils down for the individual, for each of you watching, is if you feel that you're threatened in some way, that is potentially a traumatizing situation. And also, a lot of times people will grow up having experienced trauma in childhood and not recognize that that was what it was when they were still children. And then you come to that gradual realization in a young adulthood, like, oh my gosh, that was abuse, that was trauma. That can be traumatizing too. So it's really important for us, I think, to first destigmatize the whole concept of trauma. It's not a contest, and a lot of it is based in perception and the resources that you have available to you to heal from the trauma.
Absolutely. Thanks for sharing that. So a couple key things that I'm hearing is that there trauma can be different for different people. It's about our perception of different scenarios. So it's not just about a scenario where, you were like a car accident or something where you were physically hurt, although that can cause trauma, but it can be other things where you were socially hurt or emotionally hurt. So there are lots of different ways that trauma can happen. So just kind of keeping that mindset, because I do hear from a lot of people that, oh, well, it wasn't trauma, I wasn't physically hurt. So then they don't seek help. So just knowing that there are different ways trauma can happen. So I think that helps people be more open to seeking help, and that's important. But also what I'm hearing is that it's a process over time. And in a couple minutes, I think we're going to talk about, healing from trauma and recovering, which is really important, but that it does take time, and just being kind of patient with yourself, and having a good support system is important. The one last thing before we get into recovering from trauma that I wanted to talk about was, of course, COVID, because this has been something that, we're 2 years into. It's really caused a collective trauma for society, especially for students and for educators. So I'm wondering if you can share a little bit about COVID and kind of the trauma that COVID has caused, especially for those of us in the education field.
Definitely. And it's really, I'm glad that we're discussing this, because there are types of individual trauma, and then there are things that happen that are collective traumas. And indeed, COVID has been one. So that's another way to understand trauma, is that it can be an ongoing situation that is having an impact on a person. And a lot of us in public health and psychology and medicine feel that poverty and that is a source of trauma. Racism is a source of trauma. So indeed, COVID has created a lot of changes in the way people, I think primarily in the way we interact with each other. That's probably been one of the most traumatizing aspects of the pandemic, because we've lost a lot of the social connections and just everyday interactions that often help us feel less isolated. And isolation is one of the most prominent things that happens to a person after trauma. And it's not, sometimes it's slightly self-imposed, and sometimes it is people being afraid, they don't know how to talk to you. A variety of things lead to that. And so when you add that to all the other complications of the pandemic, then you're taking away an important resource that people need in order to cope with the fear of getting infected. Losing family members. I think we're almost up to 250,000 kids now in the United States who have lost at least one primary caregiver. And that's grief and bereavement, which can also involve trauma. And so not only has it really been about just actual losses and people getting sick and experiencing long COVID, but it's also the loss of your dreams, or your what you thought the world was, or the way that you thought people were. I've been very saddened by sometimes the lack of compassion I see in some people toward other people in this pandemic. And so there are actually even some long-standing traumatizing factors in our social network that are being made worse by COVID. And so I think one important thing for people to think about is however creative you need to get is to get as much out of each social interaction as you can, and think about making those interactions as high quality as possible.
Thanks, Dr. Wheeler. I think that a lot of people probably, as you're talking, are like, oh, this makes sense. I've dealt with isolation. I've dealt with stress, grief. I think a lot of burnout, both from students and teachers, and a combination of things like missing out on milestones or getting together with families. So those things probably sound pretty familiar to people who are listening. But I think it is important that we brought them up and just kind of frame it in the light of, these things. We don't just want to brush them off. It can be a very emotional experience for people. So just to kind of give yourself that space, I think sometimes we don't allow ourselves the space and say, well, I shouldn't be this upset. And if you are feeling upset by some of those things, just know that you're not alone and that it's okay. But now, importantly, since we've kind of identified what some of those sources of trauma might be, how do we, Dr. Willer, start going about moving on from that isolation, the grief, the loss of milestones? How do we start to recover from trauma?
Great. Well, the first thing is it's really important to start to recognize, and you already touched on a couple of those, recognize the signs that you might be affected by either chronic or acute trauma. And a lot of times people end up getting diagnosed for something like anxiety or depression, when actually what they have is perhaps a form of PTSD or post-traumatic stress disorder, or they have a history of trauma that's making it difficult to not have depression and not have anxiety. And so there is no short list of things to look out for, because it can show up in so many different ways, like even a change in sleeping habits, a change in eating habits. A lot of the things that, again, we attribute to other mental types of mental distress can actually be signs of trauma. But even more specifically, I'd say, if you can't remember an event without feeling it in your body, then that's a sign that you might need to do some work on that memory, and some work on how you are living with the fact that this happened to you. And in the work that I've done, a lot of times we talk more about growing through or moving through the trauma recovery process, because so often people are telling them to get over it, and that often is counterproductive. And so another thing that you might notice is avoidance of reminders of a certain thing that happened, or a certain pattern of things that may have happened in the past or is ongoing, avoiding certain types of TV shows or parts of town or certain activities. And I think that the body is a really useful tool in understanding how a person is doing with trauma, because when we are affected by a traumatic stress condition, it's a mind body situation. And the issue here is that it's hard when you remember something not to actually go into that memory. And when you go into a memory, your body gets involved. It's not just a story in your mind. And so pretty much all trauma treatment, all the different types of treatment that we do for trauma, it involves being able to remember something and not get triggered by it, turning it into a story and fitting it into the overall meaning of your life. And I think that for younger people, that's more difficult, because their life, it takes up a bigger proportion of their life. I'm in my 60s, so the bad things that happen to me are in the context of a longer life. And so when I work with younger adults, it's very often putting what happened in a perspective of a big life that has space for it, and helping the person kind of grow around that trauma in a way that eventually it is just going to be a story about something that happened to them in the past.
Yeah, I keep hearing this theme come up that it's a process, and it is not not helpful for people to say, just get over it, no big deal, just move on. So really giving yourself that space to know that it's a process. I heard you talk about, diagnoses and working with a health professional. So it sounds like really working with your therapist or someone who's a trauma specialist. And I think if you're, in school, there are ways to reach out to teachers or school counselors who can help connect you with those trauma specialists or even your parents. Or, if you're trying to go through an insurance network, there are folks who can help you there. Even sometimes I found like asking a friend or a spouse or someone in your family for support, because sometimes it's hard to navigate that and just say, hey, I'm trying to find, this therapist or this specialist. Can you help me with this? Because sometimes even the small things feel overwhelming when you're in that trauma. So it does really feel like understanding it's a process, getting help from the right medical professionals. And then there is this big body component. And you can think about this as, when you're feeling stressed, for example, like when you're stressed, maybe you have a presentation and you start to feel a little sweaty, your heart is fluttering. There are different things that are going on in your body when you're feeling emotions. And it's the same with trauma. And it's just more amplified, right? So you're going to be experiencing different things in your body and have a really strong reaction, both in the body and emotionally. So what I've heard in a lot of kind of trauma treatments and therapy is that there is a lot of kind of emotional awareness that you're wanting to develop and body awareness that you're wanting to develop. And it's not just about as quickly as you can trying to process the trauma, but because it takes time, sometimes it's going through and doing things like somatics. So dance therapy, movement therapy, music therapy, just starting to feel kind of comfortable in your body and starting to build some emotional awareness of your body without necessarily connecting that to the trauma, not necessarily getting into that yet, but just kind of getting into who you are in the moment and finding some joy and some pleasure. And then when you're able to kind of build up that body awareness, that emotional awareness, then it's again with a medical professional starting to get into the trauma and starting to, be ready to talk about it and process it and see, when I'm talking about this, what's happening with my emotions, what's happening with my body, because then, when you have that awareness, you can start to learn to kind of regulate the emotions and not have that big kind of triggering reaction and response. And that's how you move on. But let me know, Dr. Wheeler, how that summary sounded. But that's kind of what I'm thinking about when you're saying it's a process. It's not just jumping into the trauma right away and getting over it, but it's really this kind of long process that typically you go through with a healthcare professional to understand your body, your emotions, and then start to get into the trauma and moving on. So curious. I know we're getting to time to hear kind of your thoughts on my summary and any other closing thoughts, Dr. Wheeler, about just recovering from trauma.
Absolutely. Well, that was a actually perfect summation and with a really great additional information. And I one thing that I would want to just point out is that a lot of times when you have a history of trauma, sometimes it comes from events that are stigmatized or very, very difficult to talk about. And so sometimes people, especially younger people, don't seek treatment because they don't even know how to start to tell someone that something happened. And this is a huge issue. And sometimes, there are a lot of different reasons for that. So what I would say is start slow. And if there is a trusted other that you can begin to share this with, to begin that process, if you feel these things happening, the sort of avoidance and changes in sleep, even nightmares. Another thing I really wanted to make sure I mentioned was what we call dissociation. And that is kind of zoning and numbing out. And dissociation happens during traumatic episodes. A lot of times people tell me they left their body during something bad that was happening to them. Unfortunately, that can become a pattern, and that whenever someone starts to kind of be stressed in some way, they dissociate, which means they kind of fuzz out. And you can tell when you're talking to someone and they do that. And so that's another thing to kind of watch for. If you feel yourself just kind of getting fuzzy, just kind of leaving the room a little bit at times when you're getting a little bit overwhelmed, is another good sign to watch for, because that can be a sign that you are really just to have it. There's a piece of your psyche that you just can't go there, and you build walls around it. And good therapy treatment is about carefully and mindfully dismantling those walls so that the light can get in and it can start to heal. And yes, it shouldn't be an abrupt cathartic process, because that isn't really how your brain works. One other thing I want to mention is that your brain literally changes the structure and the electrical activity and the chemistry of your brain changes in the years after trauma and even the months after trauma. So recovering from trauma means breaking down some of these connections that were made and rebuilding new ones. So you need to be patient because your brain and your body are rebuilding themselves. And the changes that occur in your brain with trauma affect your immune, digestive. Oh, that's a big one. Digestive symptoms, another sign that you're chronically stressed to the level of trauma. Those systems will also need time to heal. And so you need to cultivate patience and self-compassion and legitimacy. Your distress is legitimate, and it doesn't matter what anyone else has to say about the trauma, about the thing that occurred to you that is traumatizing to you. What is important is how you feel about it, and what we can do to help you move from not being able to think about it comfortably to being able to integrate it into your big, beautiful, amazing life.
Thank you so much, Dr. Wheeler. So just thinking of a couple of really important takeaways, trauma is not narrowly defined. There are a lot of different things that can cause trauma. So somebody else shouldn't be telling you what is and isn't trauma. Like, a friend, for example, if it's feeling distressing to you, it could be trauma. And the best thing to do in that situation, because it is, really a serious thing, is to work with a medical professional like a therapist and get help from, teachers, school counselors, parents, friends, to try to get some of those, appointments set up with a medical professional. And it is a process. So, you're going to kind of work with that therapist through recovering from trauma, and it takes time and you need to be patient with yourself. But I also think another really great takeaway was you're not alone. It's really common for people to have experienced trauma at some point in their lives. It can be really jarring and kind of really disruptive to your lifestyle, but you can get through it and you can get help. We have a lot of good resources too on the Neolth platform. So don't forget that kind of crisis resource button. There's free 24/7 support with different counselors that you can talk to if you feel like you're struggling, or you can reach out again to, friends, family, school counselors, and other people. But yeah, that you're not alone. I think especially after COVID, it's kind of a collective trauma that we've all gone through. So I think just knowing that you're not alone is really powerful. So thank you so much for being here today, Dr. Wheeler. We're going to close out this Neolth Ask the Experts live stream. We'll be back next month for another live stream. As a reminder, you get to choose the topics that we're going to talk about. Go to the community section on the Neolth app, vote. Your vote is totally anonymous, but you can vote for what you want us to talk about. So we'll see you for another talk in April, and thanks everybody for joining. Bye-bye.